about the public health workshops that we're running. This is a list of the whole of the range that CPPE are running, and in the West Midlands, somewhere this year you will be able to attend a public health workshop on every one of those topics. You might have noticed when you came in I was already advertising mine. On June the 14th I'm doing a public health workshop on alcohol awareness, so it's brief interventions, and then in September a substance misuse public health workshop. You can book online, but why should you book? Why should you come? So I want to spend a couple of minutes just telling you why it's such a wonderful thing to come to. Yeah, a little bit about what's happening in South Staffordshire, because we all know the NHS is changing and there's a lot of uncertainty about what's happening. So the current PGDs that we run at the moment will go forward. The PCT has given the money to the LPC already, and as long as that money lasts, those services will go forward. So I've spoken to Ruth Goldstein, who says there's at least a year's worth of money, so we're not going to lose any PGDs, which I think is a good thing. The public health part of the PCT, the lead PCT person is already now half PCT and half local authority, so the move's already happening. A lot of the PCT people are going to be moving to Stafford, to the council offices, so all that public health is moving over, but a lot of the people who already deal with it are moving with it. And what they want to do is start a healthy living pharmacies project, if you like, following on from work that was done in Portsmouth, which has been really, really successful. So the LPC are really keen on this, and apparently the local authority are as well. So in the first phase, if you like, of healthy living pharmacies, the aim is just to improve the services that we already provide. So they're aware that lots and lots of people provide services, but not everywhere does it to the same level. So it's bringing everybody up. And the experience in Portsmouth was that all the services grew in all of the pharmacies that were healthy living pharmacies, to the point where the people who I wanted to get involved at first were ringing up to say, please can we join, because they saw how much it increased the profile of each pharmacy. And then, when all of that's done, the first thing they're going to do is alcohol brief advice. So, what can we say? Start with your CPPE training, because next month that's actually the public health workshop that we're running. Public health workshops go hand in hand with our distance learning pack, so you do the two, and that would be a great start for you. So that's why public health workshops are the really important thing to come to.